Protect Me, You, Us, a shared clinical decision-making approach for adult COVID-19 vaccine conversations. This video is brought to you by the Behavioral Health and Wellness Program at the University of Colorado Anschutz Medical Campus, with support from the Colorado Department of Public Health and Environment. Healthcare providers remain the most trusted source for information about vaccinations, and there are low-burden strategies to effectively talk with patients about any uncertainty or concerns they may have. In this video, we suggest specific strategies and language that you can use to address mistrust of and concerns regarding COVID-19 vaccines. There is a three-step evidence-based process to maximize vaccine acceptance. 1. Assess disposition. 2. Use motivational interviewing, or MI, to talk it out. 3. Make a plan. These steps, built upon shared clinical decision-making and motivational interviewing skills and strategies, will assist you to increase patients' motivation for change. Now is the time for step 2. Use MI to talk it out. Once you've identified your patient's disposition, you'll want to proceed based on this information. For patients who are accepting, you can help to arrange for their vaccination. For those who are cautiously accepting, you will want to answer any questions and provide the information they need. With patients who are hesitant and refusing, you'll want to use MI skills and strategies to talk through their concerns to evoke their motivation for vaccination. MI is a collaborative conversational style that enhances motivation and commitment to change. To increase uptake of the COVID-19 vaccine by vaccine-hesitant or refusing patients, you'll want to engage in specific MI skills and strategies. Remember, the goal of your conversation is to increase motivation to get the vaccine. The goal is not to persuade them to get the vaccine. Let's watch as Dr. Kelly continues her conversations with her patients. We'll highlight MI skills and strategies that she uses to support vaccination.
So your worry about COVID has you so stressed out, and you want more than anything for you and your family to be protected.
Exactly. But you can't do it today, right? I know I have to wait for my turn, get on a list or something, or go somewhere else. Who knows where?
The obstacles feel big despite your desire and best intentions to protect yourself.
Yes, and I'm only one person. That's what I tell my husband. And it's not his fault that I'm stressed out. He lost his job as a cook about 8 months ago when the restaurant closed, and now he's home taking care of the kids, and I'm the only one working.
I'm so sorry to hear that your husband lost his job. You are both so stressed, and still you work together doing your best to provide for the kids. It's impressive.
We're doing the best we can.
I hear that. Regarding your added stress, you are not alone. So many of my patients tell me that they are anxious and worried. Like you, they just want to be vaccinated so that this pandemic can be over and we can all go back to normal.
Amen. I just want my husband to get back to work and for the kids to go back to school. And I don't want to work overtime every day to make ends meet or to go to bed so worried that we're all going to get sick.
So it sounds like you are ready to be vaccinated, more than ready. In fact, you would do it right now if we had access to the vaccine in our clinic. Your main issues with getting vaccinated are practical ones, like finding the time to locate sites that have the vaccine, make an appointment, and getting the vaccine without having to travel for hours or miss a day of work. It seems to me that if we can help you with some of those issues, you would be happily vaccinated. Am I getting that right?
Yes, definitely. If someone could help, that would be great.
Did you notice how she used open-ended questions, reflections, and affirmations to develop a sense of trust and partnership? With the space to talk through her stress, we see that much of Teresa's stress is related to COVID, and getting the vaccine could reduce some of her concerns. She's worried about her safety and the safety of her family. Without her own car, she struggles to get around on the bus. This adds an extra layer of difficulty for her to get to her appointments. And as the sole provider in her household right now, it's hard for her to take time off work to get her vaccination. We see that she's open to vaccination if some of these obstacles could be removed. Did you see how Dr. Kelly normalized Teresa's experience of feeling anxious and worried, and how getting vaccinated can help everyone get back to normal? Think about the MI skills and strategies you currently use and could incorporate into vaccine conversations. Now, let's see what's going on with Cal.
Tell me more.
Yeah, well, I'm not convinced that any of these vaccines are safe. I mean, they were created almost overnight, right?
That's a valid concern, Cal. And to be perfectly honest, I had the same concern when I first learned that the vaccines were being released. I reviewed the data very closely, just like you.
And?
Well, though it may seem like these vaccines were developed very quickly, in fact, the coronavirus, which causes COVID-19, is similar to other coronavirus strains that have been around for a long time. Researchers had already been studying these viruses. So the COVID-19 vaccine did not start from scratch. Beyond that, every possible resource was put into the development of these vaccines. Money and regulatory approval were available, and the vaccine technology already existed. And all vaccines must be proven safe and effective before they are given to people. The COVID-19 vaccine is no exception. Beyond the studies, the vaccines are being proven safe every day as millions of Coloradans have already taken them. And nationally, many more millions have also received the vaccine.
So that means you got one yourself.
Oh, I did. I got vaccinated as soon as it was available to me, and I recommend that all my eligible patients consider getting vaccinated. In fact, my 93-year-old grandmother has gotten both shots. What do you think about the information I've shared with you?
That all sounds good, but I still don't know. You say that African Americans are at higher risk of getting really sick or dying from COVID, and that's pretty scary. But this country, and especially medical research, has not always been good to brothers like me. You know what I'm saying? I just don't want to be the first in line for a new medicine.
You know the history, and you want to be sure of the safety of a treatment before you take it.
Yeah, it's not just historical, though. Right now, today, lots of black folks are not getting good health care.
It's not an old story, something that happened in the past. Healthcare inequality is still very real today.
Yeah, it shouldn't be that way.
No, it shouldn't be that way. You know, I appreciate how thoughtfully you are working through this decision. What other questions do you have for me?
I like it that you're straight with me, but I guess it would help to know that enough black people were included in the studies and that it's just as safe for us, too.
I can see why that would be very concerning to you, Cal, and I have some information that might ease your mind. May I share it with you?
Please do.
Well, I can tell you that African Americans represent about 13% of the population in the U.S. and 10% of the study participants in the Pfizer and Moderna studies. It's not perfect, but it's a pretty good representation. The vaccines were proven safe and effective for all the participants, regardless of race or ethnicity. What do you think about that?
Okay, well, that's good to know.
I'm curious, Cal, beyond the safety concerns, what personal benefits, if any, do you see from getting vaccinated?
Well, from the beginning, my biggest worry has been catching COVID and bringing it home to my ex-wife and daughter. My little girl, she has CP, and she's confined to a wheelchair, and my ex is her primary caregiver. So if anything happened to either one of them, I'd feel awful. And if my ex got COVID, honestly, I don't know how we'd care for my daughter. Of course, my ex is now vaccinated, so maybe there's a little less concern. But still, the thought of one of them getting sick, it's weighed heavy on me the entire year.
You love your daughter and you want to protect her. Protecting her has been your biggest priority this year.
Yes, she's more important to me than anything in the world.
And it's equally important to you that your ex stay healthy also so that she's able to care for your daughter.
Yeah, we've all been working hard to keep COVID away. And if the vaccines were safe, I guess that would be the obvious next step. But from my perspective, it's still a big if.
Okay, I think I understand where you stand. You've talked of your concerns about safety of the vaccines, especially in light of the rapid development timeline, as well as specific concerns for yourself as an African American man. With the caveat that we don't yet know the safety long-term of these vaccines, the data so far indicate that they are safe and effective for most adults. You feel that getting the vaccine would be the logical next step after working so hard to make sure that everyone was safe this past year, and yet at the same time, it's equally important to you that you make an informed decision.
I may not be one of the first to get vaccinated, but I'll eventually do it. I just need to know that it's safe.
You might not be the first to get the vaccine, but you won't be the last.
Yeah, you got it.
Did you notice how Dr. Kelly used open-ended questions and reflections to understand Cal's perspective? She used self-disclosure to align herself with him. We see that Cal's primary concern is the speed with which the vaccines were developed. He wonders about vaccine safety. Here, Dr. Kelly is transparent and honest about what we know and don't know about the vaccine. Cal's also hesitant given the history of how Black people have been treated by the healthcare industry. He's very aware of the inequities in healthcare today. At this point, Dr. Kelly is empathic and uses reflective listening to express her desire to understand his experience. Primarily, Cal's concern is about his health and its impact on the health of his daughter and ex-wife. Notice how Dr. Kelly highlights his value of keeping his family protected from COVID. When it comes to specific questions, Dr. Kelly focuses on responding only to his question without adding any other information. She also asks for permission to provide information, which demonstrates respect for Cal's autonomy. Now let's take a look at what's going on with Aaron.
I think I told you last time that I was in that I've already had COVID. And since I was sick for a day or two, I'm pretty sure I have antibodies. So don't really see the point in getting vaccinated at this point, you know?
You can't see any benefit from getting vaccinated since you're fully protected already.
Okay, well, maybe not fully protected. I mean, life's risky, right? People get sick. I mean, I got it. Wasn't the end of the world. I mean, look, here I am, talking with you about my asthma, just like last year. Just like every year.
It's the same as it's always been for you.
In some ways, yeah.
You also said that you're not fully protected. What does that mean for you?
Well, just that even though I've already had COVID, it means I can still get it again. And I guess I can pass it to others.
Yes, it's rare, but reinfections do happen.
Yeah, see, that's the part that gets me, you know, passing it.
Your community was hit hard, I know.
Yeah. Yeah, the construction jobs I do are mainly in residential facilities. And they had a couple big outbreaks this fall. And that's where I got the virus in the first place. You know, me, a bunch of the residents, and like half the facility staff.
So sorry that happened, Aaron. It sounds like it was a tough time for everyone.
Well, my coworkers did fine. I mean, half of them wouldn't even know they had COVID if they didn't get tested. And for me, like I said, I was only down for like a day or two. It's just like it was a bad cold. But for some of those residents who live in the facility, you know, they died. You know, and that was pretty sad.
You feel bad about what happened to them.
And my girlfriend's grandma, I mean, she wasn't even in the facility, and she was already sick with a bunch of other ailments, but she died after she got COVID. I mean, that's the thing. You know, before Amy's grandma died, like, we used to joke about all the COVID hype. Like, yes, sick and old people died, but for the rest of us, I mean, for most people, it just wasn't a big deal.
You didn't see it as a serious thing since you and your friends can't die from it.
Exactly. You know, and a big part of me still feels that way. But not Amy. No, she's now on a mission to get everybody vaccinated.
She really wants you to get the vaccine.
Yeah.
And that's why your thoughts have changed a bit.
Look, Amy's amazing, right? And her heart's in the right place. But she's still reeling from the death of her grandma, and I just want to support her.
And getting vaccinated is one way that you can show her you understand and care.
Yeah, that's it.
Are there any other reasons for getting vaccinated?
Honestly, no. I mean, I don't think I'd be doing it otherwise. And most of my friends feel the same way.
Well, I just want you to know that I am very moved by your support for your girlfriend. It's a special thing. Okay, so let's see where we are on this. You said during our last visit that you wouldn't get vaccinated even if a vaccine were available to you. And a part of you still feels it isn't necessary. On the other hand, your community saw a lot of loss because of COVID-19, and you feel sad about that. But perhaps saddest of all is the loss of Amy's grandma. And now Amy wants you to get vaccinated, and you care deeply for her, and you want to support her in any way you can. Did I miss anything?
Yeah, that's about it.
In this segment, we see Dr. Kelly accepting Aaron's perspective, even though it is different from her own. She doesn't challenge him to try to see things differently. She strategically uses reflections to evoke motivation, such as when she overshoots and reflects back to him, "You feel fully protected already, and there's no benefit to getting vaccinated." Did you notice how Aaron self-corrects and makes his own case for vaccination? Dr. Kelly focuses on what is really important to Aaron, which is his relationship with his girlfriend and his desire to support her. In her summary, Dr. Kelly starts with the reasons Aaron doesn't believe he needs to be vaccinated and ends on the side of vaccination and its connection to his core value. In this video, we demonstrated a simple 3-step process for patients who are COVID-19 vaccine hesitant. 1. Assess disposition. 2. Use MI to increase motivation. And 3. Make a plan. For more information or to arrange for additional training in motivational interviewing and COVID-19 vaccine hesitancy, visit our website www.bhwellness.org.